Now, in that outstanding performance today, Prime Minister Morrison made some significant comments about aged care. Now, these are a vulnerable cohort and we mustn't frighten them. But as the Prime Minister said, we manage the issue. Resources should be wasted on low-risk Australians. What can be done? Well, the Prime Minister argued that aged care providers should restrict visitor access to aged care residents, but he also said that exceptions could be made for end-of-life care patients. He said there should be no large group visits or gatherings, including social activities or entertainment. No school groups of any size should be allowed to visit aged care facilities. But he said, in cases of end-of-life, I know that people will want to see their elderly parents or relatives or others. I totally understand that. Aged care facilities will have the discretion to put in very strict arrangements to enable people to visit their loved ones. This is all sensible and necessary. The Minister for Aged Care and Senior Australians is the Tasmanian Senator Richard Colbeck, and he joins us from our Canberra studio. Senator Colbeck, thank you for being with us. This is an important issue, protecting the most vulnerable. Just explain that, the detail of that business about visiting aged people in aged care facilities.
Evening, Alan. Evening, Richo. Yeah, look, it is really important. Unfortunately, all of those Australians that we've lost so far through this process have been over 70, so they are clearly, in the context of the impact of this disease, the most vulnerable. And so the arrangements that we put in place today were to say to aged care facilities, 2 people per person per day. So that's limiting the number of people who go into aged care facilities. We also want the facilities to understand who they are. We want them to make sure that they haven't been travelling overseas in the last 14 days. We want to make sure that they don't have any symptoms of any respiratory disease. And we want to make sure that they conduct the visit within the rooms of the resident in the aged care facility or in an area that's set aside for visits, not in common areas where they might come into contact with other senior Australians that are in residential aged care. We issued guidelines to the aged care sector last Friday, and that information then rolled into the decision made by the AHPPC over the first couple of days of this week, and then reinforced by the National Cabinet last night.
When it comes to this thing, though, it looks to me like...
Graham, just 1 minute there. Just 1 minute to clarify.
Yep.
So what you're saying is that someone in an aged care facility will be allowed 2 visitors a day, no more than 2 visitors a day, but they'll be allowed these visitors, but they will be thoroughly checked before they're allowed to enter the facility. That's your point, isn't it?
That is the point, Alan. We want to make sure that people who are going into aged care facilities don't carry the disease in, because we understand the susceptibility of senior Australians, and we're leaving the responsibility for that to the aged care providers. And we want to make sure that the appropriate checks are held. So two visitors per person per day, and we want to understand that they haven't travelled overseas in the last 14 days and they don't have any symptoms of a respiratory disease. And we're also saying no children under 16 as well.
Good. Graham?
No, I was going to ask you specifically that. It seems to me that we are relying on the goodwill of people, aren't we? We're relying on people doing the right thing, telling us the truth. Because if I've been overseas and I got back yesterday and I march up to the home and say, oh, I got back 3 weeks ago, then we have a problem. So then there's no way you can police it, is there?
Well, the facilities will ask the questions. You're right, Graham. We are relying on the honesty of the people coming to see their loved ones. But the reality is, if they're not telling the truth, if they're not respecting the protocols that we're asking them to respect, they're putting their loved ones at risk. And so they're the things that I think, need to understand. This is about the residents. This is about older Australians. This is about making sure that residential aged care facilities are a safe place, that they can live there comfortably without risk of catching COVID-19. And you only have to look at one example in New South Wales, where 4 of the 6 people who have passed away have passed away from COVID-19 are in that one facility where Unfortunately, a worker who didn't understand that they had the disease took it into the facility, and so you can see the devastating effects of it, and that's why the government's acted.
Okay, there's another side to this, isn't there? And that is this, I mean, you mentioned the word respect, and that is the question of staff. Now, the staff are, in these circumstances, completely overloaded. You've also made a statement today, haven't you, about international students who form a very significant component of the working capacity of these facilities. They're currently, I think I'm right in saying, are allowed to work via their visa for 40 hours a fortnight. You are going to extend that or provide the opportunity for that to be extended, are you?
We are. We're going to double that so that they can work up to 40 hours a week rather than 40 hours a fortnight. Capacity of aged care facilities and their staffing is something that's really important to us. We want aged care workers to continue to come to work. We'll be providing some information to them, to aged care providers, to families and residents in aged care facilities around management of COVID-19, but making sure that we actually have the capacity to properly staff aged care facilities is really important. And so by a temporary increase in the capacity of this particular group, we'll put some additional capacity into the system. We've already made some arrangements with the states around providing a surge workforce in emergency circumstances, and we're sharing the bill with the states in respect of that. So making sure that we have appropriate capacity to staff aged care facilities is going to be very important as this proceeds.
Yeah, that is for existing employees.
The visas, would you extend that time? Sorry, I was just saying, would you extend the time? Will you extend the time of the visa? If I've got a 6 months visa, will you give me a year so that I can work on this?
So what we've done at this point in time is to extend existing employees and their visas. That's clearly something that we can consider as this continues to progress, because you've already talked about the period of time that this might have an impact on this country and the economy. So we will be looking at things as it progresses to ensure that we have the staffing available that we need.
You've got, have you not, an infection control plan? Is that a requisite of every aged care facility, or is that something that you're insisting on now, an infection control plan in the instance of some kind of epidemic or taking over in that particular facility?
No, Alan, every aged care facility is required to have an infection management plan. We bolstered that process after the terrible flu season in 2017. And so a lot of the things that aged care facilities need to do, they will already understand. So it's no different in a lot of respects to a normal flu season or a norovirus outbreak. They have processes that they would put into place to isolate people within the facility, to section it off, to make sure that an infection, if it gets in, doesn't spread. So those processes are already in place, and effectively we've said to the industry over the last 6 weeks or so, be prepared for this. We've put some information out there over that period of time. Dust your infection management plans off, get them ready. The flu season's coming anyway, so be prepared. And now what we're doing is providing some additional advice and information which needs to go over and above those infection management plans to deal with COVID-19.
You mentioned the management of non-compliant residents. Why did you make that point, and what did you mean by that?
Well, I'm talking about the people who are living in the facilities. They will obviously have to comply with what's going on, particularly in the context of isolation, in the context of an outbreak. But more importantly, my concern relates to people coming into the facilities. As I've said, we want to ensure that aged care, residential aged care facilities across Australia are safe places. They're free of the disease. We understand only too graphically the impact that will occur if the disease gets into these facilities, so the actions we're taking are specifically designed to minimise the opportunity for that to occur.
Well done. Well done. Thank you for that, and thank you for sharing those thoughts with us. Excellent presentation. Well done. We haven't heard from you before, so well done, Senator Richard Colbeck, a Tasmanian senator in charge of this very difficult area.